State epidemiologist Dr. Benjamin Chan joins us live right now and right here with more on what is going on, and he can tell us a little bit about the presumptive positive tests.
Yeah, so as you're aware, yesterday we announced our first identified presumptive positive infection with this new coronavirus, what we're calling COVID-19. That initiated an extensive contact investigation to try and identify people that may have had close direct contact with this identified individual with the infection yesterday. That has led to identification of this additional individual who developed symptoms. This is an adult male from Grafton County who we tested today, and that test came back positive. So this is not a surprise, right? This is why we conduct a public health investigation to try and identify people that may have been in close contact with someone infected with COVID-19 so that we can identify people that may be susceptible and get them into testing quickly if they develop symptoms.
And that person can quarantine at home?
So anybody that's symptomatic and is being tested for COVID-19, we ask them to isolate at home. Both of these individuals are now isolated at home and not requiring hospitalization at the current time.
That is some good news.
Yeah.
Okay, we have a few questions we'd like to ask you, Doctor. Ashley Clare asks, what is the chance that we will be under lockdown here in New Hampshire like they have done in other countries? How would we access work, school, food, and supplies? That's a biggie.
Yeah, that is a big question, and I think what people have seen from other countries, specifically China and Wuhan City, China, where this outbreak originated, has raised these kind of questions and concerns amongst our communities. I think that the truth is that we would very unlikely ever see a lockdown similar to what we have seen in other countries like Wuhan City, China. But that doesn't mean we don't have different tools at our disposal to try and control the spread of this virus if and when it becomes more widespread in the United States and in New Hampshire. That can include more extensive measures like canceling school or early school dismissals or canceling mass gatherings. These are community-based interventions that we have at our employ in public health to try and slow the spread and reduce the impact of a pandemic virus if this ever becomes a larger pandemic. But we are far away, I think, from that point at this point. Again, we have 2 cases identified in New Hampshire, both one a direct contact of the other one. The first case was due to travel to a more highly impacted country.
As in Italy specifically.
Correct.
Jason Forrest asks, I work for a delivery company doing lots of business with China. If someone has it in China, they touch something that's shipped overseas, can I get it?
Yeah, I think this goes back to the question of how is this virus, how is this infection primarily spread? This is a virus that's spread very similarly to the flu. That being primarily through direct contact with someone's respiratory droplets who's infected. So it requires close contact to an infected individual. There has been some questions and concerns out there about how easily this can be transmitted on environmental surfaces. So if someone coughs in their hands and touches a door handle and someone comes along right afterwards and touches that door handle and touches their eye, there is the possibility of that kind of transmission, what we call fomite transmission. But many of these viruses do not survive for long periods of time on surfaces. They're very susceptible to drying out. And so talking about shipping packages and shipping containers it generally is not a concern for transmission of this virus from what we know right now.
So we have our live Facebook audience, and a question just coming in asking, how long does the virus actually last on a person? Otherwise...
Yeah. So how long is a person infected? How long can we find the virus on a person? That is actually still an area under investigation. Yeah. What's being conducted anytime, what's happening anytime someone is diagnosed, in order to clear them and let them out into the community requires multiple serial samples and swabs of the respiratory passages, and it takes 2 negative samples to call that person cleared of the infection. That's part of the protocol coming from the CDC. We don't have a lot of information about how long that takes, but it can take upwards of 1 or 2 weeks from the information we have preliminarily from the CDC.
Outstanding work, Doctor. Thanks for being with us. We could do a full hour, I'm sure.
We could.
Perhaps we will as we move forward.
And thanks for the update on the breaking news
My pleasure.
well.